Millions of Americans are in danger of continuing to afford their health insurance if Congress doesn't extend the ACA tax credits. If you're on an individual health insurance plan, you need to watch this. Welcome back to another Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am sipping on some mango tea because I have a kid with strep throat and I don't want it. Before we get into it, be sure to subscribe to stay up to date on the latest health insurance news. All right, so cheers. Let's dive into ACA tax credits. So first and foremost, what are ACA tax credits? So the Affordable Care Act has subsidies included with it that can lower monthly premiums. The eligibility looks at things like your modified adjusted gross income, the number of people in your household, and where you live. The thing here that most people think about is many people qualify, but just don't know that they qualify. So now that we know what ACA premium tax credits are, let's go ahead and talk about how they work. So first and foremost, they're based on your projected income for the following year. And what they do is they're essentially a credit paid directly to the health insurer. So they're reducing your monthly premium. And the credit amounts are reconciled with your annual income at year's end. So essentially when you file your federal taxes, they'll go ahead and check this out. So it's important to note here that these are based on your modified adjusted gross income. They're not based on your net worth. So for example, if you're someone who is retiring early and has a chunk of money saved and you want to go ahead and pool certain dollar amounts to live on, I'd really recommend you work with a financial advisor or some type of accountant to take advantage of these tax credits, because if you set your income under a certain level, you'll be able to receive a pretty nice tax credit to help pay your premium. So it's really worth doing the math and working with someone to get this figured out. So the question I always get is, now that we've talked about these premium tax credits, essentially what are they? We've talked about the federal poverty limit and some of those other things, but what does that really mean? So these are the 2024 federal poverty levels. And what this is the 2024 level will remain through 2025. So the federal poverty level is $15,650 for a household of one. Now, it's important to note, I mentioned earlier that it's based on households. So let's just use as an example, if you have a household of four, the federal poverty limit or level here for a family of four is $32,150. So you can see here, 150 is right around 22.5 for a family of four. It's 46,800, and it just continues to increase from here. So it's important, if you want to go online and Google it, you can put in, how many family members that you have, and if you have somebody aging off your family and no longer on your taxes, it's important to check this out. But you can really see how it increases from there. So a few other things of note that I think are worth mentioning are, between tax credits, COVID had a lot that impacted these tax credits. So first and foremost, the American Rescue Plan Act of 2021, during that, they temporarily increased the marketplace tax credits or subsidies for these ACA plans. So then the Inflation Reduction Act came along, and what they said was, if you're between 100 and 150% of the federal poverty level, you receive a full subsidy. But if you're higher income, 150 to 400% of the federal poverty level, you'll receive a partial subsidy. And as a reminder, that just then reduces your premium on your health insurance monthly. So the groups that are especially benefited by this, rural residents. Typically these people have higher premiums. There's not as many health options out there. Low-income individuals, those between 100 to 150% of the federal poverty level, qualify for that zero premium, which is really beneficial for these folks. Last is the small business owners and independent workers. Really, it gives you more affordable options. If you have a gig type job where you don't have health insurance offered to you through your employer, this has really been quite an asset for a lot of those folks. So the question that we always get is, what happens if these premium tax credits are not extended? So a few things to note here. First and foremost, coverage will be less affordable for many. 95% currently rely on tax credits. So 95% of all people that are getting their plans from the Affordable Care Act or the exchange currently rely on tax credits. That's a significant number. Net premiums will increase by 25 to 100% for many people. I've seen a stat that on average, most people's premiums will increase by 75%. That's significant, and a lot of people just frankly can't afford that, which therefore would cause an anticipated drop in enrollment by around 4 million people. Rural areas with the highest premiums will be the most impacted. And really, at the end of the day, what we're worried about here is just the drop in coverage as a result. Less and less people being covered by health insurance, which is sort of the exact opposite of the whole point of the Affordable Care Act. So who will this impact the most? So when looking at it, I did just mention people in rural areas will really be impacted by this change. They're already paying about 10% more on average for premiums. Additionally, states that didn't expand Medicaid, this is really going to become an issue for those folks that would have been eligible for Medicaid but now aren't. And additionally, people just above that federal poverty line, it's really going to impact those people dramatically. So then we look at it, what can you do? So first and foremost, review your current plan and really get on top of what that projected income will be for you. Talk with a licensed agent. So a couple of notes here. These are the marketplace open enrollments that were eligible for 2025. There is talk that these are changing for next year. I anticipate that they will indeed change. So let me explain what they're going to do. So for 2025, last fall, the marketplace open enrollment was November 1st through January 15th. But you had to enroll by December 15th to have your plan start on January 1st. You essentially have to enroll by the 15th of the month to have it start the 1st of any following month if for some reason you're leaving employer coverage throughout the year or something like that would qualify you. Now, the enrollment's December 15th through January 15th, then they wouldn't have a start date until February 1st. But what has been proposed and what I feel very strongly will go into play for 2026 is that they'll shorten that enrollment period. So the open enrollment period will be November 1st through December 15th. So it's really important that you keep up on a lot of this because that entire month, yes, you won't have coverage for January last year if you didn't enroll until after the 15th. But, it's really important. If you don't enroll by the 15th for this year, you're not going to have any coverage, which is a pretty big deal for the entire 12-month period of time. So it's really important to stay informed about what Congress does next. I spent a lot of time reading about this, and I've seen anywhere from we might hear something about these extended subsidies this summer. It might be the 11th hour. We just don't know a whole lot of information. And a lot of times, whoever is talking about it, their political opinions are impacting it. But I've heard a whole gamut of information. So more to come there. At the end of the day, we'll have videos on our YouTube channel. Go ahead and check them out. If you have questions, give us a call. We're always here. And, any questions that you have, just let us know. Cheers.